For me now to welcome you to see the championship, where we will see the 3 best teams compete for the trophy of the EMS2017 championship. You will see these 3 teams: the Samaritan ambulance from Sweden. Final team will be the Falk from Denmark, and we'll have some closing remarks after that. The judges are distinguished experts from around the world, actually. It's Fiona Moore from United Kingdom. It's AJ Heitman, who run similar competitions in USA. And it's Ron Brendel from the Netherlands. The instructors for this will be Peter Berlak from Denmark, Bodil Thorsager, also from Denmark, and myself. We want to give a huge thank you to our sponsors from Lærdal and Falk. This championship is run and organized by the Copenhagen Academy for Medical Education and Simulation, where I come from, as well as the EMS Copenhagen. And as I said, sponsored by Lærdal and Falk. And also I want to express my really, really big thanks to all the volunteers. It wouldn't have been possible to do this without all the great help from the organizers, the sponsors, and those volunteers. Yes. As in the initial round, where the teams competed in 2 different scenarios, the scoring will be calculated based on objective points. And the technical points will account for 50% of the calculation of the scoring, the detail and degree of assessment and correct treatment of the patients, and the other half will be the non-technical treatment of the patient, the teamwork, the leadership, situational awareness, many of those things the stories just told about. The winning team will be awarded the EMS Championship Award. They will receive that award. They will also get a free registration for next year's EMS Congress. And then there will be the Audience Award. And that's for you guys to decide which team do you think should win this championship. Both of these awards will be announced tonight at the gala dinner. And for you to vote, and don't do it now. You'll have to go to the Congress app, have to open the Congress app, go to the slot, the agenda, find the EMS Championship finals, as you see here just in the bottom. Select the team you think should vote, and here again at the bottom, and then you vote. But you can only do this once. You can't regret and try another one. So wait until you've seen all 3 teams. Okay, please now remain seated, no matter what happens, and let the games begin.
Oh.
Where? Is there anybody in charge who know what's happened?
Just have a look.
Okay. Are you okay, team?
Yeah.
Beware of falling objects, electrocuted, or something like that.
Stay here.
Hello. You just came? No fire, anything electrical, anything? Scene is safe. We can enter. Just leave that one there, and if you start checking those people out, and Anna, you do the other two.
Yeah, check.
Your men are ready to help you. Excellent.
Hello,
Thank you.
Anna, can you hear me? Hello. I got no breathing, no pulse.
No breathing, no pulse.
Is it breathing? No breathing.
Hello, my name is
No
Anna.
pulse.
Can you hear me?
Okay.
What's your name?
So he's quite okay.
Okay. Okay. Do you
I
have
have
any pain,
penetrating
Matthias?
trauma in the eye.
Yeah.
Can I go over?
Okay.
Yes.
Lukas,
Yeah?
penetrerande trauma, vaken.
Just leave him for now. Tar du honom, starta med honom, så
Can I
kollar jag
cut?
vad de har där.
Men, yeah.
Can I cut clothes?
Okay.
I will help you, sir. Just wait for a little while and we'll be with the right way. Så har du koll här, Camilla?
Okay.
Du har koll här? Bra.
Yeah, penetrating trauma in the eyes. No breathing.
Yeah.
Are you ready to?
Ja.
No pulse. Are you ready to take this off? I will step back. Lucas,
Yeah.
we're preparing
breathing.
to take this patient free from the stage.
Ja, men jag...
Breathing.
Do you
Okay.
want me to look at this one?
Han är okej för tillfället. Tar du den alltså?
Lukas, egenandning.
Ja, egenandning.
Can I
Med.
stand here?
Jag ska bara sätta en ton.
Shallow. Ja. Ytlig andning.
Lucas,
Ja. Ja.
I'm starting CPR.
Lukas, jag kopplar 10 liter på mask.
Ja, gör du så?
Yeah, please.
Vad vill du
You can
göra
do the
sen?
compressions.
Jag har satt en tourniquet här.
10,
Jag går och
we
kollar
switch
på de
on
andra.
15.
Ja, jag tar han den andra
13,
killen.
15. Please help. Thank you.
Så.
Så.
Pocketmasken, kan jag ta den andra eller har den?
Du kan ta den med här.
Oh. Hello, sir. We'll be with you right in a second. Can you please stand with him for a little while and we'll be right back. We'll be right back with you, sir. Yeah, I know, sir.
Okay for you?
Can you please hold the leg like this? And I'll be right back. We'll be right back, sir.
Då får ni hjälp här.
Penetrating trauma. How
So.
much bleed is coming from the ear?
Lukas,
Ja.
instabil bröstkorg vänster sida.
Vad sa du?
Instabil bröstkorg vänster sida.
Ja,
Och 10 liter på mask, tourniquet.
Mycket bra. Ha en andas annars så.
Ytlig egenandning.
Excellent. Kollar du på honom så kollar jag här borta också.
Ja.
Did it rise? Did you feel
I'm
it
going to
rise?
help you. You have pain in the...
Hello, ma'am. Hello, ma'am. How are you? It's no worries, no worries. If I
Could you
just...
just lay still here and help you, okay?
Just sit down,
Yeah.
take some couple of deep breaths.
Okay, Lucas.
Can't see anything. I think I'm blind.
Are you blind? Just follow me. Just follow me, ma'am. I will take you up where we can have a closer look at you.
The breathing frequency.
Yeah. How old are you?
24.
24. Is it both eyes you can't see with?
I can't see anything.
I don't know what happened.
You can't see
Lucas.
anything at all.
Can you come later?
Excellent.
Check you over
If you
here.
just sit down here for a little while, I'll be right back. So. Just be careful, I'll be right back. Har du koll på den där, Anna?
Vänta.
Hur går det? Kommer?
Alltså, här är han blöder. Det är substans som kommer.
Okay.
Ingen puls, ingen andning.
Okay. There's not so much we can do for him right now. So
Okay,
just
we'll
leave
come
him
back
for
to you,
now.
okay?
Thank you for the help.
Thank you so much.
Lukas,
You can take care of the other ones. Yeah.
100 saturation, bilateral
Thank
andningsljud,
you.
okej?
Mycket bra. Are you still okay, sir?
Vad ska jag ta?
You're still okay. I will give you some pain relief. Just
Hi, how are you?
Yeah. I'll be right back at you with some pain relief.
Where does it
There's
hurt?
so many people there that have to take care of. I'll be right soon.
Okay. Okay. Do you have any pain more in your arm?
What? It really hurts.
Okay, I understand.
And it's
Yeah.
Anna.
I'm listen you, okay?
Tar du han där, han börjar bli sämre. Behöver koppla lite
That's hell.
syrgas
Okej,
på
tar du
honom.
henne då?
Ja.
Hon verkar helt okej.
Ja.
Bra,
breathing
förut.
and thin
Men du, vi
pulse.
har en syrgas, den prioriterar vi.
Han där med syrgas, för han har penetrerande.
Japp.
Ja.
Camilla, omfall
Is it any
syrgas på
better
honom.
if you try?
Vad sa du?
Omfall syrgas på honom.
Syrgas på honom.
Ja.
Han har precis börjat andas bättre.
Här har du en mask. Där.
So team, we have 4 persons. These 2 in need of medical assistance right away.
Hello.
We
Yeah.
have 2
It's Camilla.
patients
I will
in
help
pain over there.
Yeah.
I'll check them out.
I will give you some oxygen.
Yeah.
Ja.
So if you take care of those 2, I will check up the
You
other
do
one and
really
see if
well.
anyone else
10 liter
is
på mask,
on
Camilla.
stage.
10 liters.
10 liters.
Bra.
I put it so you can breathe.
There
Okej.
is the bag.
Ja. Ready, Alice?
We are doing the
You're
best we
really
can right now, ma'am.
Really?
We'll be with you in just a
Yeah.
little while.
Svag radialis på henne, Lukas.
Svag radialis.
Vad vill du göra nu?
I understand. We are doing
Hur tänker vi?
Just take care of that one. And
Yeah.
if you can get some pain relief for
Hon är
her.
okej, hon är okej.
Yeah, that would be nice. Excellent.
Shall we remove this?
Nej, vi låter den ligga tills vi har bestämt hur vi ska flytta honom, tycker jag.
Hello, sir.
Inte det?
Nah, I know.
Can't stand up.
Does your
Vill du ha något annat på honom?
Lay down for a little while and we get you some pain relief.
Camilla?
Sorry.
So, we,
Do I have the bile?
yeah, I will have to leave you for a little while. No, it's okay, man.
honom.
Just stay with him. That will be so fine. He's in pain now, but
okay?
we will take care of it.
Ja. Vill du ha en station på honom, Camilla? Ja.
How's your vision, ma'am? Yeah, we will take care of it really soon.
Thank you.
Ska vi ta ett tryck?
I will put this on your finger.
Har du någon radialis?
Yes, thank you.
Har du någon radialis?
Känner jag radialisen? Ja?
Ja. Okej, då skiter vi i trycket.
Nej, du kan sätta den. High flow. 130, yes.
How is it, team? Do you need any assistance? Allting okay?
Ja, vi har penetrerande trauma här.
Ja.
Hon
Vill ni ha
fortfarande-
någon väska?
Nej, det är bra.
Är det bra?
Ja. Kör inget mer på henne. Jag prioriterar här.
Jag tycker du ska ta hand om det också. Vi har en, här förvänder vi oss att vi har lite backup.
Ja.
Vi har en stor blödning vi har åtgärdat.
Ja,
så att-
nej.
Vi har ingen syrgaspenning.
Nackkrage,
Prioriterar
Lukas.
syrgasen på honom.
Ingen
fortfarande.
syrgas.
Okej.
Sorry.
Be with you right
Radialis?
Mr. Fire Chief, do you have any oxygen in your truck?
And
Yeah, do you have any oxygen in your truck? No, thank you.
Okay.
We'll just sit with that lady for a little while and
how
keep
does
her
the
calm.
leg-
That would be really pretty.
Hur känns benen?
Yeah, send it down.
The right leg.
Hello, sir.
I can't. Yeah.
Yeah, I'm preparing
can
some
feel
pain
it.
pain relief for you. I will be back in
It's
like
a broken bone.
1 minute.
Okay, then.
So just
Femur.
take
And
some
bleeding?
couple of deep breaths and we'll be back.
Har någon en tourniquet?
Ja.
Big bleeding?
Jag har en tourniquet här.
Tourniquet?
No. Första förband.
Första förband.
Sorry. I will just... jag ska bara flytta ditt ben här lite.
Breathing better?
Så vi har penetrerande skada.
Ja.
Breathing frequency?
Ja.
20.
Fixar du själv?
Jag kan behöva hjälp att få runt det.
Vad sa du?
Jag kan behöva hjälp att få runt det här
Ja,
benet.
jag ber.
Yeah, I'm
Do you have any more firefighters? You do? Yeah. You're available. Can you please help her remove the structure? Good on you.
Lukas?
Ja?
Övertryckspneumotorax tror jag punkterar vänster.
Övertryckspneumotorax. Nolldekomprimerar du?
here.
Japp.
Can you do that?
Behöver du någon annan hjälp?
Japp. Nolldekompression.
It's very hurt. Just lift the leg a little bit so I can put this on.
Mycket bra. Jag tänkte ge honom lite smärtstillande där
Ta upp
borta.
nolldekompressionsnålen för mig där.
Yeah, I know it hurts.
Mycket bra.
Decompression in the... Is it okay? To do in the doll? Ja? Du? Nolldekompression?
Då ska vi se.
Nowhere? Okej. Okej. Då har vi förmodligen en pneumohematorax på vänster.
Ja,
Ta nålen.
mycket bra. Just keep her calm, sir. We will take care of you as soon as possible, but we have some other patients that we're treating right now. And we will really, but you
Behöver
will
du
this
något,
fine
Camilla?
officer
Jag
here.
funderar på om vi ska smärtlindra, sätta en
No,
infartssmärta.
there's
Vill du ha
some blood
nasal
in
eller
the
inte
eyes,
nasalt?
and I have to do some major checkup before I can see what that is. But you're in good company with a good fire department, and he will keep you calm and steady.
What?
Good thing.
Okej, bleeding.
Är det okej, Camilla?
A critical patient.
Ja. Vi kommer att smärtstilla med intranasalt fentanyl här.
Intranasal. Jag har
Tack,
dragit
Lukas.
intranasal fentanyl här.
Lukas, jag har till henne.
Ja, har du en madtippa?
Japp.
Can you
Jag har allt.
help me?
Har du en till?
Japp. Camilla,
Hold it.
fentanyl.
No.
Ja.
Den här är kritisk, vi har en pneumohematorax vänster.
Ja.
Jag har nollkomprimerat, det kommer vara
50
blod.
mikrogram fentanyl
Så,
intranasalt.
Uh,
I'm gonna give
high
you
breathing
some,
frequency.
painkiller.
She have
Hello, sir.
probably hemothorax.
Are you
on the left
allergic to any
Yeah.
medication?
I don't know.
Okay.
I don't
Tell
know.
me.
But you're a healthy person otherwise? And no
Can you
allergies?
sit
No.
here?
Radialis?
No medications that you tried that you
Breathing
have?
No.
and,
I'm going to give you some pain
so
relief
it's
up your nose.
Please. Up
Behöver
my
du något
nose.
mer?
Yeah, it will hopefully help you.
Yeah.
So, there you got
Vi
it.
ska sätta,
Thank
har
you.
jag fortfarande radialis?
So,
When will it work?
instantly.
130.
Yeah.
Vill du ha någon
Thank you.
vätska på han?
I would take the edges off.
Nål i alla
Vill du ha en
fall. Jag vill ha en
Just
info.
watch
Jag
his
kan
breathing
sätta
for a
nål.
while.
Kan
It
du?
should be fine because, but yeah, you stay with him. Excellent. Thank you.
Kan jag borra? Ja.
Jag kan sätta härifrån. Ska jag det?
Japp.
har 0 där. Den där.
Bra jobbat, har ni koll på det?
Vi har fortfarande stabil här. Frekvens på 70, andningsfrekvens på runt 28. Blod vänster. Och sen fortfarande armtrauma.
Vi förbereder dropp här när vi ska lossa på den så
Mycket
småningom.
bra. Om du kör en ATA på...
Luftvägen fri, har en kantarell nere.
Yes.
Andningen är dämpad vänster.
Breathing.
Jag snurrar den
Count,
hemothorax.
respiratory rate for me.
Långsamt. Ja.
Ja, andningsfrekvens på 28.
Ja.
I put the needle.
Cirkulatoriskt så har vi en frekvens på 70, men den är tunn. Disability har vi inte kollat.
Nej. Du fortsätter med det.
Ja,
Vad bra.
återkommer med det och E.
Ja,
Skickar ut
super.
dropp sen när du har tid.
Pupils. Dilaterad pupill höger, Lukas.
Ja.
Breathing.
Ja,
Thank
Ja,
God.
ja.
shouldn't.
Så vi har ett misstänkt skallskrama där också.
Ja, dilaterad höger. Får jag din S-katt, Lukas?
Vad sa du?
Får jag din S-katt? Vänd om.
Varsågod.
Får jag droppet där?
Vad sa du?
Får jag dropp på väg?
Okej. Okej, nothing. Okej.
Are you awake?
Vilken sida var det han hade?
Dilaterad pupill
Vänster.
Need a
höger.
painkiller? Help
Ja.
me?
EUA.
Ja.
Jag kan ta den till Camilla.
Ta den till Camilla.
Okay.
Jag ska ändå
bleeding
bort där,
in
så
head.
stannar du där.
Ja.
Ja.
Still in great pain.
Ja.
Vill du ha mer
något mer,
fentanyl
Camilla?
eller?
Jag har kvar här.
Ja, vad bra. Om du kör en ATA på din patient.
Ja. Fri luftväg. Bilaterala andningsljud. Andningsfrekvens på 36. Känt igenom nacke
Ja.
och kokhälar, ingen smärta.
No worries, sir. I'll be with you in right a second. Absolutely. Ja.
Radialis har jag tunn.
Ja.
Jag har penetrerande våld i buken. Jag har fraktur höger ben.
Thank you.
Bra jobbat. Thank you.
Okay, thank you, Sweden.
Thank you.
So, team leader, what's your plan now?
I'm hoping there will be a second ambulance really soon.
Have you called for them?
On our way in. He said, no way we're going this by ourselves, so sort of taken care of before, but we didn't call out for it. But primarily we'll have this gentleman taken care of, and secondarily that guy. The other two managed to do some good for the gentleman over there, but the lady there was still in pain, but not so much. So, call the emergency ward, let them know what happened. We have possible neurotrauma trauma on that one. This one certainly needs surgery as well. So,
What do you suspect on this patient?
a lot of things actually.
Just give us the report to the hospital. How many patients? What's wrong with them?
This is Lucas, ambulance 10 from Lund. We are at the City Congress Hall where we have met 4 patients that had major injuries due to some trauma in there. Some happened with the state, we don't really know what, but we are leaving the scene with 4 patients. Number 1, adult male with possible head injury, damage to the head, big bleeding, conscious, but got pulse and got circulation, and managed that on his own. But we would really like a neurosurgeon to take a look at him because of the dilated pupils. The other gentleman, number 2, sorry for calling you that, major bleeding, but conscious, shallow breathing, problem with ventilation, big trauma to the abdominal that we haven't managed to sort out in a satisfying way. So we would like that to be taken care of straight away. The other girl, trauma to the head, problem with bleeding in the eyes. We haven't really have able to do some major look-up on her eyes, but she goes on a lower priority because she's awake, conscious, good breathing, good circulation, awake and clear. And on E we have trauma to the head, but not massive, that we did the assessment of. The gentleman, patient number P4 as we call him, with trauma to the leg, very problem with anxiety. We have given him some fentanyl due to pain, but he's also conscious. No problem with the airway, no problem with the breathing, and circulation was also fine. We have some on E. He had a fracture on the leg. Otherwise, he's good to go. We have a fifth patient that's not coming in as P1 that we just.
Excellent. Thank you very much. Let's hear it for the Swedish team, people. Thank you. Okay.
You grab your stuff and we'll take you out over here.
Okay. Thank you.
Wow, ladies and gentlemen, wasn't that impressive stuff? I really wish I spoke Swedish to understand what was being said there. Ladies and gentlemen, my name is Richard. I'm a physician from the UK. I work in emergency medicine and pre-hospital care. And just for 10 minutes or so, I'm going to share with you some thoughts about how we might manage the critical brain-injured patient in the pre-hospital setting. Now, one of the things that struck me as we look at all of this, think about all that equipment we've got, all that rescue equipment, resuscitation equipment. Imagine what it would be like to have to deal with an unconscious brain injury patient with no equipment. So this is our colleagues in, we'll have the sound up if we can, in Africa at a staged boxing match. Boof, down he goes. He's not moving. So what are we going to do? Meticulous C-spine control, as you can see. And you want to expose the patient really fast. And hypothermia is really important. So induce hypothermia with ice water. Stimulate him. Really stimulate him. Look at that. Straight in there. Good old hand job will wake him up. And if that's not working, we'll throw in a bit of waterboarding as well. But look, he's still totally unconscious, totally out of it. Now, what about nearer to home? This is a real-life case that I was involved with in the air ambulance. Now, it's very rare we get to see footage like this. Pay close attention. Peter's out for his shopping, hit and run. He's unconscious on the road. He's probably in traumatic brain apnea. He's not breathing. Now look at the bystanders. 1, 2, 3, 4, 5. No one does anything. He probably just needs his airway opened. Finally, someone arrives in the middle there, calling the emergency services. Peter is unconscious. This is the damage that happens to the car when your head hits it. This is the force that has been transmitted to Peter's brain as he was struck. If we could just relieve that pressure really fast, take the blood away, everything would be okay. That brain is crying out for oxygen. It's crying out to survive, and we need to help it survive. And we always need to be thinking, what do we need to do now, and what do we need to be doing in the next few minutes? Because clearly the priority is to get Peter somewhere where we can relieve this intracranial hemorrhage. But in the meantime, what are we going to do to get oxygen to the rest of his brain, to keep it alive? Meticulous attention to basic airway management. Just in the video, all Peter probably needed was someone to do a good jaw thrust. He probably just needs really good basic airway management so he can take that breath and fill his lungs again, using the adjuncts if we need to. And probably one person on the team just needs to be focused on the airway. And clearly that goes hand in hand with oxygenation. Now you need blood pressure to get the oxygen round your body to Peter's brain. And what can we do? Well, initially, relieve problems that might be lowering blood pressure, like bleeding or tension pneumothorax. And later on, we can see other measures we can do to get the blood pressure back up. And crucially, ensuring they have a normal blood sugar level. And then wherever you work, you might well have some sort of enhanced care team response. And I think the most important thing is not to say who, but to say what. What does Peter need? I think the evidence for pre-hospital anesthesia now is becoming more and more clear for the blunt neurotrauma patient. Evidence from Australia, from the Netherlands, from Scotland, from all over is suggesting that the earlier you get your anesthetic, the better. And in the UK, our national guideline says you should get it at scene and within 45 minutes. It doesn't matter who does it, they just need to do it safely, smoothly, in a well-governed system. Because pre-hospital anesthesia to these patients allows us to secure their airway, deliver 100% oxygen to the lungs, which is more than we can do by any other means. We can ventilate them accurately. So your end tidal and your carbon dioxide in your blood is directly related to that pressure, which is already pretty high. By ventilating them down to normocarbia, we can offset a bit of that. Striving for that mean arterial pressure above 80 to keep the brain perfused. We might want to give them a top-up of blood or give them some medicines to boost the blood pressure if we need to. We've talked about the sugar, and we can keep them at just 30 degrees heads up. We're replicating what would happen in a neuro ICU setting. But we haven't forgotten about where Peter needs to go. Where does he need to go? He needs to go to that center to take the clot out, and he needs to get there really, really fast. And that's the reason we use the aircraft, to get the patient straight to the right center in the shortest time we possibly can. And actually what we're looking at is saying, well, can we combine these things? Why waste time to do the anesthetic at the side of the road when actually we could do it all together, couldn't we? Just like the military will pull Peter into the helicopter, take off, get going, and deliver that ICU care in flight would save a lot of time. But en route, let's just say Peter's pupil blows. It's fixed, it's dilated. What are you going to do? Yep, we can give some hypertonic. Yep, we can ventilate them a bit more. The crucial thing to remember is Peter is not dead. He's not even brain dead. If you look at this study from London, depending on your type of bleed, over 50% of patients could still have a good, meaningful outcome even when they'd had a blown pupil. And where does the patient need to go? He doesn't actually need to go to the emergency department, do they? They need to go to a scanner to find out what is going on to allow the next phase, either neurosurgery or neurointensive care. So that's exactly what we do. We don't go to the ED. We meet the team in the scanning room, hand over in the scanning room, and save off those valuable few minutes in the patient's journey of care. Now, when I say neurotrauma, you think of the big sexy stuff, don't you? The car crashes, the guy getting hit in Brighton, the motorcyclist hitting a tree. And you're right, that is a big amount of what we do, the young, male, fast boy racer. But what's the reality? The reality is actually that with road safety is getting better, there's less of it, and this is the reality. The reality is, this is the new epidemic of major trauma and major neurotrauma. Betty's 85, she's on warfarin for atrial fibrillation, and she falls over and bangs her head. And no matter what data you look at, you will see that this is becoming very, very common. TBI death and injury death in the over 65s is going up and up and up. And how are we going to account for this? Well, firstly, can you measure their INR on the side of the road? Well, of course you can. There's no point in waiting until Betty's GCS3 from her trip and fall to reverse her warfarin. Old people have much more space in their head. They compensate much better. So actually, we'll measure the INR as soon as we can, and if it's high or if we think they're bleeding, reverse it there and then in the pre-hospital phase. Don't wait until they get to the hospital. But the decision-making around this can be really hard, can't it? Are they bleeding into their brain? Have they just had a bump? Do I go to the trauma center? Do I go to my local hospital? So we need to embrace new technology. This is a microwave brain scanner. People say, Richard, you've never been the same since you zapped your head like that. What it does is it just transmits little microwaves between these pads. 3 seconds it takes to do a scan. And we're hopeful that technology like this will be available to all of you in the not too distant future to say, have we got a big acute bleed there? Do we need to go straight for neurosurgical intervention? So we talk a lot about it takes a system to save a life. But in brain injury, it takes a system to save a brain. Because actually, we don't want to just save Peter or Betty. We want to return them to the same quality of life. We want them to go back to work. We want them to be the same person to their wife, their husband, their children. And just one small interruption can make the difference between Peter, who, by the way, did very well, going back to work or being in the nursing home at the age of 30. So we need to think about what we're telling these bystanders on the end of the phone. How are we training them to manage the unconscious trauma patient in the same way we teach them bystander CPR? We need to get our basics absolutely brilliant. And we need to work with those enhanced care teams to make sure we can deliver the advanced interventions like anesthesia really early. Stay one step ahead, get the patient to a scanner, get the patient to a center that knows how to deal with critical neuroinjury, and crucially, make sure that the rehab is good. Because if we do all that great work, unless they're rehabbed, it's all going to be lost. It takes a system to save a brain. Thank you very much for listening.
hello. Where's the chief? The chief from the firefighters. Hello. Okay, is the sun safe? Can we go there? Okay.
All right.
Okay. Okay. We begin with this. Okay. Okay. I call to my dispatch. I need more ambulances and a helicopter. Okay. Hello. Hello. Okay. Snowing green. Okay. Okay, doe nog zitten. Okay. Achtung, okay.
Good. I'll have neck.
Okay, is goed. Hemorrhage is stopped. Okay.
The other arm.
Also. Ist gut. Wir tun es so lang.
Jag sitter.
Okay, er snuffet, wir tun es so lang. Okay, let him like this. Okay. Okay. Next. Hello. Don't move. Okay, don't move. You have a foreign body, okay, in the abdomen. My name is Nicole, I'm a paramedic. We will help you, okay? It takes a few more minutes. How's your name?
Peter.
Peter, okay, Peter. Stay calm. Can you breathe, okay? Okay.
It hurts.
I just checked the
It hurts
pulse.
so bad. It hurts.
130, okay. Okay. You say Peter is your name?
Yes.
Okay, Peter, in the moment, we give you some... Okay, we're the firefighter, chief firefighter. Okay, can you come here? Okay, we have a foreign body we have to cut this. Okay, can you take the?
Okay, don't worry, we take care of you.
Okay.
Just stay with us.
Oxygen. Okay, I go to the next.
Okay, stay in your place. You just get some oxygen, huh? Don't worry.
Sorry. Hello, hello.
Take care. Okay.
No reaction.
Think over that, please.
Airway. Not
Foreign body
breathing.
there.
Okay.
Need some oxygen there.
And when I make subluxation, chin lift.
You get
Okay.
some oxygen.
Okay.
It helps you to breathe
Stop.
for a moment. Huh? Wait a second. Okay.
Okay.
So is it
Listen,
effective?
we have to remove this. It's possible. Okay.
We just put it away. Super. Okay, perfect. Okay, I take care of him. We have oxygen, use it okay. Fine. What do you want next?
Das ist Sauerstoff.
Sauerstoff.
Das ist gut, das ist gut. Okay.
Okay.
Tut er hier, der ist tot.
Gut.
Hier ist das, okay? Tut er hier weiter schauen mit der Feuerwehr. Ich gehe schnell schauen. Okay?
Okay. We have to get them. That's perfect. You can stay here with me, please. So, we have the oxygen that we
Okay.
try to. We have to.
I need a
transport it
firefighter who
somehow.
comes with me.
We still have the foreign
Yeah.
body in here, so we have to put something underneath.
Hello. Okay. Good. Hello, my name is Nicola.
So I won't
Okay.
do it anymore. Don't worry.
Okay. Okay. In moment we have a critical situation. You have to stay here. Okay? Can you look at him? Can you look at him? Okay?
We don't move
Okay.
it that far.
Okay. A major incident. Okay? Stay calm.
Get something,
Okay?
But my legs are
Okay.
hurting so bad.
This is not so important. I'm sorry. Okay? Stay calm. We look for you until another ambulance comes. Okay?
Can you have some?
If he becomes unconscious, you come. Okay? Can you come with me? I give you
Yeah,
Oh yeah,
you with
that's a
me?
good idea. Please.
Okay, just talk to
Come with me.
You have enough oxygen. So, okay, we just have a check over
Okay.
that.
You can put this on him.
Just stay there.
Yes, to my...
Okay, hello, can you walk? Can you walk?
Okay.
Hello, I'm Nicola, can you walk?
Okay.
Okay, come with me, come with me, come with me.
Your shoulders, you have some pain.
A firefighter, please, firefighter.
I don't move it there.
Okay,
And I touch you here on the back. Do you have
Okay.
pain there? Okay.
okay.
Yeah.
You take
Can
this
you get me,
patient and you go there, by the other, okay? Okay,
Okay. All right.
Okay.
Just stay like that.
let's go.
We will first
Let's go.
aid
Okay.
the vessel. We make a splint over there because lots of pain there, might be fractured. The rest of
Okay.
And I touch here on the leg. That's also painful. Okay.
Okay, for this.
How do you have a scissor? Yes, master.
Okay, good. Det lukket her, hè?
Ja, ja.
Is goed. Okay.
Where's the schere? Good.
ist gut. Okay.
Okay, I'm sorry, I just have to settle a minute.
Okay, Peter.
I did already.
Peter. Okay, don't move, huh? Okay.
Sorry. Okay, it's more here. Okay.
Also,
We have to do the pelvic other.
nein, wir nehmen Schaufelbarre.
Oui, c'est ça.
So, huh?
Ouais.
Okay.
Okay. A is okay. B, C, we have the foreign body here. We have possible fracture of the pelvis.
Okay.
Okay. I'm sorry. Can you get me not this spine board, the other one, the extraction? Yes,
Sorry.
board. Thank you. Okay.
Eva, how is the D? Neurology.
Well, he's still alert. We just have to check them. We'll have to do the C first.
Peter, can you move the leg? Peter, can you move the leg? Okay, he can move the leg.
Yeah, his left leg, but not the right one.
Okay.
Not the right. Okay.
The right leg, you'll feel a femur fracture.
Ja,
Okay. Also,
Okay.
ich lüpfe.
genau. Also, genau. Aber wir haben rechts ist etwas weg, Oberschenkel gebrochen. Rechte, weil sie einfach
Ich
nicht.
lüpfe. Ich tue lüpfen, hä?
Ja.
Eins, zwei, drei. Sorry.
Gut, ja. Alright. We'll be better soon, don't worry. Okay. Okay. You might feel some
Sorry.
pressure now.
Geht gut.
Okay, okay. Thank you very much. It just... Ja, zu Schulter drüber. Ne? Hörst du ihn schnell? Okay. Musst du aufpassen.
Firefighter, it is okay there.
Okay, do that.
Huh? Yeah, yeah.
You can have a look. Okay.
Peter,
Okay. Peter,
Sorry.
just take
Sorry.
your arm. Okay.
I take your head. 1, 2, 3, 2.
Kein Stiffen.
Okay.
Okay.
Wil je hier blokkeren, hè? Christel, als je bij Christel hebt.
Ja. Laat de Christen naar hem.
Hast du Beine?
Ja.
Okay, yes. You can go there. And I will call you when I need you, okay?
Du musst vorne mehr zusammen, sonst kriegen wir es nicht zu. Du bist vorne zu weit auseinander.
Okay.
Am Kopf muss vorne weiter zusammen. Hörst du? Ja. Okay.
Was ist los?
Da haben wir so Schmerzen im
Ja,
Oberschenkel.
schon, aber geht nicht.
Nein, wir kriegen es aber nicht zu, weil es draussen zu weit auseinander ist, verstehst du?
Das ist auseinander.
Nein, das ist noch zu weit da vorne. Es hat so viel Spannung.
Aber jetzt ist gut.
Nein, eben nicht.
Okay.
Okay, wir tun es einfach.
Christel, come to the head.
Komm rüber.
Okay, Peter, stay calm. Okay.
Alright. Ja, okay. Nee, weil oben ist es zu weit auseinander, das kriegen wir nicht. That's broken.
Sorry, I'm sorry. So,
It's not working.
so
Okay.
good.
Okay, take the
Also.
hat. Okay. Ich hab den
You
Kopf.
and me, 3. Oh, Peter, okay?
Okay.
Peter, we will move you. 1, 2, 3. Crochet. Regarde, du musst zusammen tun.
Ich hab den Kopf noch.
Kannst du nicht.
Ist gut. Okay. Okay, dann
Halskrage.
Halskrage haben wir das. Hast du den Kopf?
Okay, we'll stabilize your head. Sorry.
Machen wir da.
Yes.
Wait for me. Okay.
It's good. One firefighter, please.
Okay.
Can you bring
Den hast du den Kopf?
the brancard?
Warte, das ist gut.
Yes, here, please.
Was willst du machen?
Die Decke.
Ja.
A, B, C ist gut.
Ja, wir sind am Kontakt.
Ah, ist gut.
Sechs Fuß machen.
Der ist okay.
So that we
Just
can
put
go.
something under your head.
Wait. Okay, we coming. Can you come help us, please? Okay, we come after, okay?
Don't go.
Okay,
Okay, Nicola.
we take the patient on the stretcher, okay?
We throw down there.
Okay,
Wait.
break.
Okay,
Perfect.
stay there.
Okay, Christelle, you are on the head.
Yeah.
You say, okay? When we move, you say, he's the chief, Christelle is the chief, okay?
Okay.
Where is the head?
Wait.
So the oxygen, we just need to take the oxygen.
Also, oxygen, remove.
Okay.
Oxygen. Okay. It's okay. 1, 2, 3. Stop. One more time. 1, 2, 3.
Okay, third time.
1, 2, 3. Stop.
Okay, one belt, securize the patient. Christelle, you stay on the head.
Yeah.
Okay.
And the other one here. Patients. Okay, we just put it down in the ambulance now. And then we take care of the pain. Something like that. Okay. Have that? Okay.
Okay.
Die anderen hast du im Griff.
Die Backe einfach. Ja, they're crying.
Okay.
Oxygen.
And now we get some
Okay.
I think there's
This one.
some oxygen running.
Okay.
All right.
You come down, Christelle. Okay. We take this. Okay. You go to the ambulance.
Yep.
I will come.
Okay, we go. Ambulance, okay. Hey, merci. I'm sorry, but the
Okay,
painkiller
team
will
leader.
come right now.
So, plan of action. What's your radio report to the hospital now?
Sorry, my English is too bad. Can you repeat, please?
And you can do it slowly.
Okay.
I want you to call the hospital and tell them what you're coming with. Short and sweet.
Okay. At the moment, I'm coming with one patient. He's critical with a frame body in the abdomen. He's instable. He's critical. And he's in NACA 5. And we come in about 10 minutes. I don't know where we are.
Okay, that's fine. We'll be ready. Anyone else coming?
Yes, by my dispatch, I had said I need more ambulances and helicopters. Yes.
Okay, fine. Any idea what we were expecting of patients? How many? What's wrong with them?
Eva, I'm sorry. Eva, kannst du schnell aufkommen? Du musst mir helfen bei der Übersetzung.
We'll have a bit of translation up here.
Yeah, that's
good.
no problem.
No problem. Okay, very quickly, I'm the hospital. Tell me, how many patients am I getting? What's wrong with them?
Okay, at the moment we have one critical patient who's coming, another one with amputation on the forearm on the left side, and the other ones, two smaller casualties. So altogether 4 right now,
Okay.
as far as I know of.
Thank you very much. We'll be ready. All right. Thank you. Let's give him a hand.
So,
If you grab off stage, all right?
Ladies and gentlemen, my name is Jakob Steensballe. I'm very honored to be here as the second intermezzo talking on the second killer in trauma. TBI is the first killer, hemorrhage is the second killer. I'm a consultant anesthetist working with trauma 70% of the time, and the other 75% I work in the blood bank with transfusion medicine. So my point is this. Isn't it just fantastic? This is major hemorrhage. This is as good as it gets. Isn't it just beautiful to see no clotting at all. This is actually really, really bad for trauma. Up to 30% of trauma is challenged by this coagulopathy, and we really should strive to have it to look like this. This is in my ED or OR. This is another center. So this is how we go in Copenhagen. So trauma-induced coagulopathy is a killer, and it's actually so that approximately 1/3 of patients arrive with coagulopathy, and if they have coagulopathy, you see here that the mortality increases up to 100%, just having this coagulopathy on arrival. But what is actually the best way of treating coagulopathy in trauma? What is the best way? Yeah? It's actually to stop the bleeding. If you stop the bleeding, then you can consider other aspects as well, but coagulopathy is not a high priority if you control bleeding, and just by understanding that every drop of blood is a bleeding that is too much, bleeding should be stopped, and this can help us treating patients with preventable death. So we should really stress this. We should really focus on stopping hemorrhage at the scene of the accident, or if you're actually working here, it's the same. We should do our best to stop hemorrhage. Every drop is actually counting. You should really try your best to stop the bleeding and avoid further hemorrhage. So we all focus on the ABC, but actually, as you know, it's the CABC that is actually what is now taught, that we have to control major hemorrhage, and then we go for the ABC. So stop the bleeding and then go for the rest. Make sure that the brain is perfused. Another point is that shock is actually the driver. And even though that we can increase the blood pressure, we can give fluids and so on, we can't treat the shock as the underlying condition. We need the surgeons to do that. So that's one of the very honorable tasks that we do in the EMS services or in the ED or in the early phase, to make sure that we facilitate the patient goes to the surgeons as quickly as possible. Get them to the surgeons, reduce the time to knife as much as possible. I really like your notion, Dr. Lyon, on doing en route and in-flight maneuvers. But what about the coagulopathy? Do we have anything that we can do to relieve the coagulopathy, to treat it early? We have the CRASH-2 trial, 20,000 patients randomized for tranexamic acid or placebo, showing a benefit on mortality by giving tranexamic acid early for patients with suspected significant bleeding. Just capturing the patients with bleeding, but especially the patients that actually is bleeding, they have the largest benefit. A reduction of mortality of approximately 15%, but just giving 1 gram of tranexamic acid for suspected significant bleeding. This is extremely important, and here again we see the essence of time. That if you look at the effect here, you can see within the first hour, you have the largest reduction in the odds of mortality. So again, getting this intervention in there in patients with bleeding is extremely important. This should be done unseen or en route to the hospital. So tranexamic acid should be used early. We should work with it. That should be part of our toolbox for hemorrhaging patients. And then they need the fluids, right? The more the better. Fluids is good. Or is it? Actually, this is a challenge because for many years we've been working with fluids for hemorrhaging trauma patients. But actually all the data that we have out there, when you adjust for other risk factors for mortality in trauma, if you look at patients that is hypertensive, that's normally the patients that we give fluids. We increase the odds of dying by giving fluids. That is in the general hypertensive trauma patient, in the blunt, and in the penetrating trauma patient. We induce the odds of dying. So remember, these patients are not bleeding fluids. They are not bleeding starches. There are no potatoes in there, so they are bleeding blood. So in the pre-hospital phase, we should focus on not giving too much fluids, only give what is actually needed, being very permissive about the hypertension, unless you have severe TBI suspected. But in the hemorrhaging patients, you should go low on the fluids. Don't dilute, don't aggravate the coagulopathy. Give them something that is actually helpful for them. They're losing blood, so what about giving them blood, or equal. This is just a study from John Holcomb's group in the US showing us that within the first hour, if you have patients arriving randomized to either a high dose of plasma and platelets as compared to half a dose, and you intervene by the 8th minute, already within the first hour, you can see an effect on survival. This is survival curves, and every snap on the curve is actually a patient dying. So giving high dosages of plasma and platelets already within the first hour actually affects mortality, and especially in those that is trying to die from bleeding. So high dose plasma, platelets very, very early is something that protects our patient from hemorrhagic death. We have looked at this in HEMS services again to see that if you have HEMS giving transfusions, you can actually reduce the risk of dying and also reduce the risk of coagulopathy, getting a patient that is not that diluted, not like coagulopathic as compared to patients receiving fluids. So therefore, it's actually a great thing that we can work with these things. We have the HEMS service in Denmark flying with 2 RBCs, 2 plasmas. This is Dr. Jesper Dirks that is actually working with in-flight transfusions. And especially as you can see, this is a HEMS doctor. He is supporting the sound of the machine going like this, giving transfusions. So this is extremely important that we have to do interventions en route, in flight. So therefore, it's a great honor that we just, on the 1st of May here in the capital of Copenhagen, actually started a solution where we support our patients bleeding with freeze-dried plasma in all the mobile physician-manned ambulances in the capital of Copenhagen. So this is something new for us, and this is a new step forward. So blood should be used as soon as possible, preferably in the pre-hospital scene, but unless on arrival in the hospital. And we should really focus on hemostasis. We should really focus on that coagulopathy do not develop. That goes for TBI, because if you have TBI, then you have a hematoma expanding. If you have patients trying to bleed to death, they will bleed further. So coagulopathy is important. So stop the bleeding, reduce the time to knife, use the tranexamic acid early, preferably pre-hospitally, and reduce the fluids, go low, and get the bloods in there, plasma, platelets, and maybe RBCs. Thank you.
Scene side. Hello guys, emergency services. Is it okay us to enter this? The scene safe. Okay. We just came. Yeah. Can you tell me anything? Can you tell me what happened? The ceiling fell down or? Okay, and how many guys are you?
We are 3 guys.
3 guys. Do you have an amount of casualties?
I don't know. I can count 3.
3. Okay. Have you evacuated the rest of them? Are they outside the building?
No.
I can see just a lot of people sitting around, so. Okay. Come on, guys. Money, can you take
I take this one.
patient over there? You want to look at this one?
Yeah.
What you got for me for, guys? You have one?
What's your name?
Is he stuck?
Hello. What's your name? A clear. Peter.
Okay.
Any response?
Peter, I'm just going to evaluate.
Snoring.
No.
Okay. Does it help?
Take it.
Ren pulse?
Peter.
Helps.
No pulse.
Okay.
Okay. Okay. So no pulse breathing. You haven't been.
Okay.
Is there anything in the mouth?
So I think we're gonna leave him by for the first time. Is that okay with you? I'm just gonna take a quick look around if there are any more patients.
What is color? Pale. 130 pulse. Any bleeding?
So it helps. Okay.
Fire brigade?
Fell out the back now.
Accepted. Yes.
My feet.
Hey, please help.
Please
Have a look at chest.
They're hurting so bad.
Could you
Please
please be quiet?
Unstable.
My feet are hurting. Bleeding. Please, sir. Please, sir.
Yeah, but
Please, sir.
you look at me.
Yeah.
You can talk.
Yeah.
Yes, and you can breathe slowly.
Yeah.
Yes. I'm gonna bring a
How fast does
firefighter
it go?
to you, and you
Yeah,
can.
but it hurts so
Yeah,
bad. Please.
we're gonna take care of you.
Can you move your leg?
Is that okay?
Yeah, but my legs are hurting. Please don't go. Fire
Yes,
brigade.
team. Can I get a firefighter over here?
Fire brigade. Can you move this?
You just. No, you just stay.
Can you stay?
Have you got any first aid education?
My legs are.
You know first aid?
Normal.
You're a firefighter, so you know him. Could you
Okay.
take care of this patient? He can talk, he can breathe. He has
loose,
his leg.
Thank you.
Okay.
Is there any signs of cyanosis in the eyes, lips?
The firefighter's gonna help you.
Slight cyanosis.
Any patients anywhere?
How deep is the respiration?
So guys,
Shallow.
can you give me a short report?
Okay.
Okay.
I have a patient with a seat problem.
Keep on doing your work, guys.
Get down here.
It seems to be all over the place.
Unpack
Oh.
this one and put it over him.
Can you come with me?
What's happening?
IV applied.
I can see anything.
I have a look at the patients. Can I feel?
Do I get a firefighter over here?
Very weak pulse, 70. Okay.
Is your arm hurting? Okay.
Capillary refill time.
Can you
More than 4
let
seconds.
me bring
Okay.
her to the safes?
Yeah.
Just take me.
Let's
Yeah.
have a look.
Okay.
IV applied.
Come over here.
Here. Okay.
What's happening?
Where is it?
You're gonna take good care of
Is it
you. Can you over
in
here?
there?
Can we just sit right here? Can you sit down? Can you sit
Is it
down?
on the upper arm?
Do you know first aid?
Have a look.
Okay. Can you make a quick look at her and give me a report? Honey? Honey?
This.
Can you give me a short report?
Short report.
Yeah.
I have a patient with a C problem. Pipe to his.
Oh, penetrative trauma.
Yeah.
Okay.
He's pale. His tachycardia, and his rapid breathing.
Okay. Honey?
Peter, I have to move your legs a little bit.
Bleeding stopped. Okay.
It's okay?
Wound down here.
Tonic is on, yeah.
It's a C problem. Okay, you can lie her down.
Bandage. We're going to
Make her
press
feet
the
go up. So he's cardiac arrest.
Keep him warm. Okay.
Still breathing.
Okay, so you want to
Keep him
sit. That's
warm.
okay with me.
Fingers.
So 1, 2, 3,
Dull
4,
breathing on
5
this side.
patients.
Dull. But I can hear breathing.
Any more
Yes, but
patients
it's dull.
lying
Okay.
somewhere I haven't
Flail
seen?
chest.
Yeah,
Still
but you have to do with the pain right
Going to
now.
help you.
70. Okay.
Please,
And there's a sign of
firefighter,
pale to
you have a
look at.
very important task
Pale
here.
or sweaty?
You need to calm them down.
Pale but warm. Okay.
So, I got a report from dispatch that we were the only ambulance
Okay.
at scene. So Peter Berlak, I'm looking at you. Are there any ambulances
I'm going to help
coming
you
to
now.
the scene? Yes. So, dispatch,
I feel the stomach.
I am giving you a short
Yeah.
report. I have entered the Congress
What about
room.
here? Stable.
I have 4
Can I
casualties,
feel anything?
and I have declared a patient dead out here, so I need 3 more emergency ambulances.
Saturation.
Still breathing.
And I really need the helicopter
28.
also. So could
hard
you
to ventilate?
dispatch this to the
Is it
Congress
hard to
Center?
ventilate? Okay, fine.
And which of you guys are dispatch?
Just put this on.
Peter, do you feel pain anywhere else? Where?
There's no. And Libet,
Your stomach,
did you hear what I was telling you? I ordered 3 more ambulances and the emergency helicopter
Hypo.
services
Hypo.
because I need blood on the scene. Yes, is that okay with you? Yeah, thank you.
Where is he?
Pushing fluid rapidly.
Okay.
He won't
Wait a
listen
minute.
to
So
the
it's running
firefighter. I think
rapidly.
he's in a lot of pain. I think he needs some painkillers.
No response.
Please,
We met.
just keep.
Yes, you look at me.
You just.
We met yesterday, and you
See,
were.
right dilated pupil, no, not reacting to light. Yeah, different.
But he's still in a lot of pain. I don't know what to do.
And you were also agitated,
Yes.
so you need to calm down. Okay.
Some bleeding from the ears.
Yes, I know.
He needs painkillers,
But-
not me. I'm a
But I can assure
He
you,
fell down from the balcony.
pain is not going to kill him.
He won't calm down.
No, no.
So much pain. I give him
Yes.
anything. Give him anything. Help him,
Yes,
please.
firefighter, it's your job.
No signs of the bleeding. Only what you see.
Honey, are you in control?
His stable at 93 and blood pressure is now running.
Have you put an IV in and pushing normal setting?
Just evaluate.
Normal saline.
How's the respiration now?
Okay.
Still 28 and shallow. Scalding that side.
Okay.
And all means that I can't hear it
How
very
much?
well.
Have you examined her at all?
Yes, she's bleeding in her head.
Can you still hear me?
Muffled sounds. Okay.
Okay.
She's hurting.
But there sounds.
What is your name?
Okay.
Michael.
And I hear
Is
breath
the
sounds.
cyanosis
What
getting
hit you in the
better?
head? Was it the ceiling?
A little.
Peter, breath sounds on both sides.
No.
You hear what you hear.
But
Perfect.
can we agree that you can talk?
Okay.
Yeah. So
Your
you
blood pressure.
you need to calm down because
Pulse is still,
if you breathe
A little bit.
deeply and
Peter, you have
push,
to take a deep
And
if you
it's
have
cold
a
up here
ventilate, you're
and
gonna
warm
get really
down
sick.
here.
Okay. Yeah,
So
that's
I
very
suspect
good.
neurogene shock.
So the patient is breathing. I'm gonna take a pulse in the wrist.
Still, we have
Ventilate him
Who's
instead. Again.
which of the judges are answering for this patient?
stop the bleeding with
I am Bodil.
bandages.
So I'm taking a wrist
And
pulse. As skin temperature. Is he pale and sweaty or? Okay. Is it okay for you to sit up? I'd really like you to lie down. Yes. Yes. Lie
Good
down.
blood pressure, please.
And it's very important that you
Ben, do you need
breathe
anything?
deeply and exhale very slow. I know your arm is hurting, okay? Any chest pain?
Very weak.
No. Abdominal pain?
Reassessing bleeding.
Hips?
I put a bandage on
And you walked on your leg.
abdominal.
So can you hold a hand?
Okay.
Make her calm down?
Yeah, I can do that.
Yeah, it's okay. It's very important that
It's
she
quite
takes slow, deep breath, exhale very slow. Can you do that for me? Okay.
I'll just help. This
Peter?
ventilation.
We're
Sports
going to
ventilation.
help you. I can't give you anything for the
Bent.
pain right now.
Bent, I need a short report from you.
Yes, I have an unconscious male
Yeah?
with a big C bleeding. I got a tourniquet on.
Okay.
I have a shallow respiration
To
at
support
28,
ventilation.
and there's muffled respiratory sounds on the left side.
Balance.
But you can ventilate him.
I can support his ventilation.
Okay, okay.
I'm
So
just,
you're not thinking tension?
no, not at the moment.
Okay. Just keep watching because when you support the ventilations, it could
Thinking
develop a
neurogene shock. He's warm
Okay.
from downstairs, and it's the pulse is 70,
Okay.
but weak.
Yes. Do you? So we have a massive B and C problem over here. Is he
Yeah.
awake?
No,
He's not awake.
3 on glaucoma score.
Okay. Thank
And
you.
the pupil.
You have a massive B and C problem over here with a penetrating trauma.
A C problem.
Okay.
Bleeding from
No.
here. Internal.
But we've stopped the bleeding over there.
Is he coughing?
But we can't stop that bleeding.
No.
So this, for now, have to be
Had to
priority
breathe
one.
now. Okay.
Actually, I can see blood leaking out. Are you sure it's
Just take
stopped?
a look again.
Okay, okay. Do you need a? Can you
It's hard
put him
to
up with a
breathe
scoop
now.
stretcher?
Okay.
Yeah, I can take him the scoop stretcher.
Could
Okay.
Suzanne help
I'm gonna
get the
decompress.
scoop
Take
stretcher?
the scoop stretcher, bring it here, and 2 blankets. Fast.
Right.
Can I put
Normally, I'm a very friendly guy, but you really need to
take
calm
it
down, or I will get agitated.
Okay.
We talked about this last.
No, yeah, but a little bit rough. Okay.
We talked about this on Tuesday.
No difference in it. Thank you.
Peter, we're going to help you. I'm going to be ready to move you in a second. Okay?
I'm still
I'm
holding
gonna
ventilation.
call dispatch. Anne Lippert, are you there? Can I get an ETA on my...
2 minutes.
2 minutes. Oh, thank you very much. Is that both the ambulance service and the helicopter emergency?
Yep.
Okay. Are you doing okay, guys?
Yeah.
Doing fine. Peter, are you
Switching
awake?
to oxygen mask again.
Okay. Is it been hard breathing? Is it harder for you to breathe now? Okay. New blood pressure. I still have a C problem. I have applied fluids, big 4 IV.
He really looks pale. Yeah. So can you scoop him up real quick? 2 minutes, the next ambulance coming, and then your patients. Bent?
Yeah.
You're the next one.
Peter? Okay.
Second priority.
Second priority.
Yes, so when they are finished scooping up him, we can put him on a spine board. Yes. Yes. So no development. He's still breathing, still talking to us. Okay.
And don't step on him.
Thank you very much.
Lige bruge dig op på scenen til en rapport.
I just need 2 minutes for my team. No, 2 minutes. 10 seconds.
Team Denmark?
Yes.
Team leader, I need you to give a very short radio report to the hospital about what's happening here and what you're coming with.
Yes. Well, back in my emergency service, I would call the coordination center because I have a mass casualty situation and they need to decide which hospital the patients are going to. So I'm going to call my physician who's on duty. Yeah.
What are you going to tell him?
I'm going to tell him that I'm at the scene at a congress center, and it's leading paramedic calling from the Danish EMS team. We have 5 patients where the ceiling has fallen down at the congress center. There's one guy who is dead, and I have a patient with a traumatic amputation of his left arm. He's breathing shallow and has a massive seat problem. We have stopped the bleeding. I have a patient who's pale, shallow breathing, penetrating trauma to the left side of the abdomen. And that's actually the one that we're going to give priority 1. The one with the amputated left arm is going to be priority 2. I have a lady with a potential head injury. She's stable for the moment. That's my priority number 3. I have a very annoying, agitated patient who has broken his wrist and feel that he's going to be the one who's going to be treated first. So I'm going to put him down as a 4th priority. And I have a patient who injuries is not. He can't live with those injuries. I can see brain tissue. I think that's about it. Anything, guys?
Okay. Right, and then I'll say thank you. Let's hear it for the Danish team.
Ja. Jeg venter lige med at sige noget. Ja, men vi skal lige have dem ud. So this was the end of the finals. I hope you enjoyed yourselves. This is the time to vote now. Please find on your app the way to vote. Vote for the team you think did best. And then come to the gala dinner to hear the result. Thank you.